Hello, welcome to Ask the Latina. Today we're going to talk about a wonderful career that I am very proud to talk about because we all have a hero in our life. And this particular person in my life was my mom, Emma Beltran. She was born in Uncilla, Bolivia, South America. Inspired by her father, Dr. Arturo Beltran, she graduated from the American Nursing School, La Clínica Americana in La Paz, Bolivia. Upon graduation with high honors from her class, she became a registered nurse, and she went to be a director at the nursing school of Catavi, Bolivia. She later returned to La Paz to work for Clínica Isabela de Católica, and then she received a contract to work for the Consul of Chile in Indianapolis, Indiana, as a traveling nurse for their children. Upon the end of that contract, the Consul of Chile sent her to work for Hurley Hospital in Flint, Michigan, which is now called Hurley Medical Center. She worked there for 31 years as in the operating rooms, in labor and delivery, and ambulatory care clinic. This photo of her in the operating room can be found today in the Hurley lobby, and I'm very proud that she's there. After retirement, my mom worked for General Motors as a nurse there as well, working in a different kind of area, which was at Flint Metal Fabrication Plant in the health clinic for 3 years. She leaves a legacy behind as a trailblazer for other Latina nurses from Bolivia and other Latin countries. My mom, with 2 doctors, started setting a day of the week to serve the Hispanic community of immigrants that not were able yet to speak or understand fluently English. Here's a clipping of her in the newsletter where the hospital proudly addresses their service with my mom, the registered nurse, and 2 Latino doctors, one from Mexico and one from Argentina. Hispanics are the largest and the fastest growing minority population in the United States, and their numbers are expected to triple by the year 2050 to constitute a quarter of the total U.S. population. So it's the number in the hospital patients that's also going to increase. About 4% of RNs in Tarrant and Dallas counties are Hispanic. In contrast, more than 1/3 of the population in Dallas County are almost a quarter of the population of Tarrant County are Hispanic. Only 7% of the nation's registered nurses are Hispanic. And the percentage of Hispanic nurses educated at the baccalaureate level or higher is even smaller. There is a need for more Latina nurses. So today we have with us Monica Oviedo, who is also a nursing student. Monica is going to be here to share with us her journey into nursing school. Monica, thank you for being with us today in our show. I really appreciate it. Tell us about yourself, Monica, and also a little bit more about where you were born and about your family.
Well, first, thank you for having me on your show. My name is Monica Oviedo, and I love traveling. I love watching the sunset. I like being by the beach. I'm originally from San Luis Potosí, Mexico, as well as my parents. We were all born there, and we came to the United States in 2000.
That's great. And why did you decide to go into nursing school?
I mainly decided to go into nursing school was when my sister gave birth to my first niece.
Oh.
I was present in the delivery room when my sister was giving birth to her. And I could see the nurses, they were tending to my sister. They were comforting her. They were monitoring her pain level. And to me, that was very interesting.
Mm-hmm.
They were very caring. And when my niece was born, it amazed me how quickly they were able to get their job done.
That's great. Are there any other members in your family that are also in healthcare?
My sister and 2 cousins are currently in the nursing program.
Oh, okay.
So we will have 4 nurses in our family.
That's fantastic. And I'm assuming that they're all bilingual?
Yes, they are.
That's
yeah.
great. There are programs. Well, what's the process, first of all, of applying to nursing school?
The process is it's long. So they require prereqs. The prerequisites are mostly science courses.
Uh-huh.
So it's anatomy, microbiology, life science, and they do require general education courses.
Did you take some of these classes in high school then?
No, I took these in college.
Okay, so required before you got accepted into nursing school. Okay.
And then after that, some schools require you to take a nursing entry exam.
Okay.
Once you pass that, you apply to the school, and then they would decide if you get in or not.
Okay. Wow, it's quite a process. How long does it take?
The whole thing, you can probably do it in 3 years.
Wow. Okay.
And then after that, it's another 2 years of nursing school, or
Okay.
3, depending.
Okay. So you're taking the first 2 years and kind of like an associates with the undergrad or the prerequisites that you need, or okay, and then you get the process where you have to get accepted, and then you're at the
Correct.
nursing school. Okay, great. There are programs in some states that their main priority is to recruit Hispanics into nursing. Looking for some of those programs that I listed on our website, Ask the Latina, I find that they encourage Latino members to post also on our website to make sure that if you're aware of any programs, please put it on the educational page. But part of the recruitment process in these programs are including sponsoring events for the family so the parents would understand the demands and the benefits of attending nursing school. How important would it have been to have such an event for your parents?
I think it's important that the parents get involved so that they know what their child is going to go through, so that they know what is expected of them.
Yeah.
Because I think in a lot of Hispanic families, we value our time with our family members.
Yeah.
And with nursing school, they're not going to have a lot of that time.
Yeah.
So they need to be there, and parents need to be educated on that.
That's fantastic. So these are very valuable events that most institutions should consider doing then. Did you find any scholarships in nursing?
I know for some community college they do offer nursing scholarships, but you need to be in the program, admitted, before you can apply to them.
Oh, okay. So that's one of the requirements, huh?
Yeah.
Well, that's good to know. What does it cost to get your education in nursing these days?
So I would say in community colleges, it's around $5,000 to $10,000. That's from the moment you're admitted to the program. In public schools and private schools, they can range from $30,000 to $60,000.
Wow, a lot more.
Yeah.
What a big difference.
Yes.
Wow. So the cost of education has a greater return on investment, however, with the annual salaries ranging from $44,000 to $95,000, and maybe even more if you specialize. Did you have any obstacles, and how did you overcome these as far as applying or in the process?
I ran into some obstacles, mainly because I'm a first-generation student in the United States. I was born in Mexico and I came here. So I had to learn how the system worked at a university level and a college level.
Right.
And I also had to learn how to study for my science courses. And they were very hard for me.
Yeah.
And I overcame them by keep trying. I tried over and over again until I got it right.
How old were you when you came here from Mexico?
I was 7 years old.
7 years old. So you think if you'd been a little bit younger, it would have been easier with the language? Was that a barrier or not? Because I think you already adapted by that time, right? Really easily, because you're still young enough, right? Yeah.
I think if I came here at a younger age, it would have been more helpful.
More helpful, because yeah, you'd really just blend in there real quickly with the language. It's so easier. The younger, up to age 4, a child can learn up to 7 languages, which is amazing.
Wow. Yeah.
And we adapt so easily. So how beneficial is it to you to speak both English and Spanish fluently going into a career like nursing?
For me, like you mentioned, there are Hispanics coming in. The Latino population is growing, and I think we definitely need more bilingual speaking Latino women, not
Yep.
just women, but as well as men.
Yeah, in nursing.
And I think having that ability to speak both English and Spanish would help my patients.
Yeah. I went through, with my mom being a patient and also being a nurse, that it was and kind of opened my eyes to see how much more personable and more attentive a doctor that was speaking Spanish to us, because even though my mom spoke fluently English, it was still comforting. And to find a nurse also, but it was very hard. I mean, I'd say one nurse and one doctor is all we found in most of the hospitals that I've been at, so it was
Yeah.
difficult. But that connectivity meant a lot. We could see, and the respect was a little different from another doctor. You can see how they would say "señora" and all this stuff. It's really different, and it's something that is so important when you're in a very scary situation, like being in a hospital, or for some sort of condition that you don't know what's happening. So, upon graduation, what type of nursing degree will you have?
I will be receiving a registered nurse.
Okay, fantastic. So there are various levels of nursing according to the education level. As Monica mentioned, she's going to be a registered nurse. Let's review some of those levels that we have and what it requires in education and certification. You see this, we got one of the greatest appeals for nursing is the sheer number of pathways available for entering the field. Everything from entry-level positions to higher positions with a master's degree. So, associate and applied science degree, which typically would be about 2 years to complete, would provide someone to become a licensed practical nurse, a licensed practitioner nurse, which is LPNs. That are the best suited for being in areas where they're going to be working with different structured care needs, which is really more of working under another registered nurse, and also working with predictable chronic health care needs in hospital or long-term care facilities. The Bachelor of Science or a 2-year associate's degree in nursing or in a diploma in nursing school connected with a hospital or 3 traditional ways that a person can get to be a registered nurse. And also having a bachelor's in science as nursing, that's a program for 4 years, and a duration that can also be a little bit longer, but yet that student who already has a bachelor's degree in an unrelated field, let's say in science, they can go and enroll to be a nurse and significantly reduce the duration of the program and go through it really fast. So 4 years bachelor's degree, as we see in the chart, we see that a registered nurse would be associates, a bachelor's degree or associate's degree, a 2-year associate's degree in nursing, or get a diploma. But there's also areas where you have a master's degree, and nurses are allowed to be more specialized then, like a nurse anesthetist, which is CRNA. They're certified and registered, and that's where a nurse anesthetist is someone who will work in the surgery admitting anesthesia to the patient. With this, there's a very high level position of being specialized and also a very higher salary. And a nurse administrator for another way to be specialized. Nurse midwife, there's a nurse educator and faculty member. There's also clinical nurse specialist, nurse practitioner. So specializations allows nurses to focus on their career on specific age groups and specific disease areas and set conditions and specific healthcare settings. Some of the many specialized roles that an RN plays within healthcare are case managers that manage the long-term care plans for patients, dialysis nurses, and other nephrology nurses, gerontology and pediatric nurses, intensive care nurses, emergency department nurses, labor and delivery nurses, like my mom was, and then also such areas as scrub nurse and surgery, psychiatric nurses, trauma nurses, travel nurses, forensic nurses, correctional facility nurses, office nurses, occupational health nurses, school nurses, and many more. We can go on with the list. So Monica, do you plan to specialize eventually in one of these areas as a registered nurse?
I do. I want to go into neonatal or labor and delivery.
Good for you.
Thank you.
My mom would be very proud of you. I was always happy about her doing that, and she always told me that, she would see so many babies, and she got to be there when my kids were born, but also for many of the members of my family. So what would you say to a young Latina that is in high school, to consider being a nurse?
I would say don't limit yourself to the schools or colleges to just one school. Make sure you research as many as you can and find out about their program, what the requirements are,
Right.
as well as find out how much it costs, because that's important. And like I said, don't limit to one and apply to as many as you can.
Yeah.
So that way you have a higher probability of getting in.
And also, while they're in high school, they probably should should they make sure they take more sciences and focus on math? Or is that something they're going to be okay with if they do it later?
I think they should focus on their sciences and also get a mentor to
That's a good
help
idea.
them and guide them through the program.
That's good. That's excellent, excellent advice. Is there any other messages you'd like to give our viewers out there, looking at you as a mentor possibly?
I would say don't give up. It's a very long, hard road. Just keep pushing yourself and don't let people discourage you. Don't let schools discourage you, because it is a hard and tough program. If you really, truly want to be a nurse, do every possible thing that you can, and you will achieve that goal.
Yeah, that's great, Monica. Thank you so much. Continuing education in areas of cultural and linguistic diversity in patient care is important. Hospitals have invited me to present to their group of non-Hispanic physicians and nurses on how to culturally communicate with a Hispanic patient. This is an effort that the hospitals do to address disparity of Hispanic caregivers. I hope you have learned a lot from Monica, and we will continue to provide information on scholarships and jobs in nursing that are in our educational portion of our website. And also professional members who also can provide to our website on AskTheLatina.com. We encourage you to also add any other information or recommendations that you can give in the area of nursing. Together as a community of Latinas, we can encourage our young Latinas to consider being a nurse and as a career, and also increase the supply of culturally and linguistic competent nurse leaders so they can improve the health outcomes in our Hispanic community. Thank you for being with us, and we look forward to seeing you again in another episode of Ask the Latina.